KP, thank you so much for being with me today. I can't wait to hear about what you're working on with InOn Health.
Great. Really nice to be with you today, Logan.
I've heard over the years about really interesting work you're doing in communication, really communicating to populations about their health. We can get into that, but I want to start with a position that I know you have promoting healthcare equity in Colorado. So what's some of that work that you're doing?
Great. Thanks so much, Logan. So I'm really enthusiastic to be recently named as the chair of the Colorado eHealth Commission. I was appointed by the governor of Colorado to that commission a little less than a year ago. And what that commission does is it's focused on all health technologies in the state of Colorado and how they can better serve people. And the mandate that I've been given with the commission by the governor and lieutenant governor is to focus on digital health equity and inclusion. Okay. So how these technologies can serve everybody better.
Okay. Well, let's unpack those terms because equity and inclusion in health have become buzzwords. So we really have to think about how we connect them to actual services and value. So how do you think through that?
Exactly. No, that's a great question. So there's a few layers to that, right? So with the pandemic, as we know, technology in the healthcare space and how we live has been transformed, right? And so people now have been using more technological means to connect with their providers, with their insurance companies, that kind of thing. The issue is not everybody has been able to benefit equally from those tools. So simple example, if you have a provider and that provider wants you to log into a patient portal to connect, right? If you come from a population where everything you do is on your phone, or maybe you have limited access to internet, or maybe you don't regularly see a provider, it's not sufficient to say that just because we have a patient portal that everybody has access, right? And so there's a lot of work to be done to make sure that every segment of our society, including those people that are less technologically enabled, they might have a mobile phone, they might use text messaging, whatever it may be, we need to get them in the fold. And the way our technology has evolved, not everyone is capturing these benefits.
What are some ways that InOn is trying to tackle that particular challenge?
Right, so from an InOn Health perspective, we're focused on what we call omni-channel communications and multicultural engagement. What that means is our customers who are health providers and managed care groups, we're helping them better connect to people through the channels that make the most sense to them, right? But then not just the channel, but also the engagement or the communication that most resonates. So that because if we don't resonate at a communication level, people won't take the actions that we want them to take. We want people to show up for the comprehensive annual visit. We want people to take actions where they might be able to reduce their A1C. But the bridge to that is how we engage. The unique part of our model has become multicultural consumer insights. Okay. What that means is that we're now building a proprietary data set which tells us some really interesting things about how diverse populations engage content and what that means in terms of their care-seeking behavior.
What's your vision for how that data can be used in the future?
Right, so our view is that this question hasn't been answered well by industry yet. In other words, what is good engagement, right? Let's say there are patient engagement tools out there, but they've been serving the majority population. So if we took that data to benchmark what good engagement is, it'd be telling us a very different story than if we looked into our diverse populations. And so our company wants to be a leader in helping define in the industry what good engagement is for multicultural and how that links to outcomes.
I'm curious, is there a reason why this particular challenge is a passion of yours?
Yeah, so for me, my family's from Ghana, so both my parents are Ghanaian. It's a country in West Africa, and I was born in the US, but coming from an immigrant family, we had all kinds of challenges around not just healthcare access here, but also cultural literacy and fluency in terms of even my mother and my parents and how they think about healthcare coming from an African country is very different. And then they were in a US context. So, and me, I kind of live between worlds. So I think I've always kind of had a passion about this issue. And it's an issue that I think resonates with many Americans because we have so many diverse populations in the country now. And the way patient engagement has been done and member engagement has been done isn't sufficient for where the market's going to include everybody.
Yeah. Is there a message that you would send to other health innovators about how to think about equity when they're planning the next sort of phase of their business?
Right. There are two things in equity that I think are of paramount importance. One is about data, and two is about tying equity to value. So on the data side, you can't sustainably change what you can't measure. When we think about health equity, we're talking about understanding the drivers of disparities in health outcomes between different populations. That can be different racial groups, different socioeconomic groups, whatever the metric is. There are lots of data challenges for us to understand that. Like, do we have complete race and ethnicity data? Do we have information on our LGBTQ population and how they fit into this equation? That data is necessary to measure. The other part of the story is about financial return. For better or worse, financial returns are a major variable in how investors and others make decisions. And I think right now what's happened with health equity is there's a conversation that this is the right thing to do. This is what we need to do in our society. But there's a secondary conversation which needs to be about how we tie reducing disparities to financial value, reducing costs, improving clinical outcomes. And I think the more linear we can make that kind of connection point, the more movement we'll see in terms of venture capital and in terms of other stakeholders really truly investing in the space.
Do you feel like you've been able to connect those dots at InOn Health?
We have
to
been.
Value?
We have been, but I think there are other companies out there that are also connecting those dots, and I would like to say we're fighting the good fight. And I think with venture and with other financial stakeholders, there's a cohort of them that are starting to really think deeply about this issue and about the connection to financial value. But I think there's still work to be done at an advocacy and policy level on that. Because if we can help people understand the tie to financial value, and we can have data that helps us clearly link our interventions to outcomes and show reductions in disparities, those two things I think will make a major market shift.
Is there, when you just alluded to advocacy work that needs to happen, is there a particular, regulatory framework that you're thinking about that needs to be changed?
I think it's at all levels of our policy making and different influencers in the market space. So there are a wide range of stakeholders, from state and local government to CMS. The American Medical Association and the American Hospital Association have been starting to do work in this space. So I think it's really let's just say a team effort across a lot of different influencer spaces to get this to move.
Yeah. Okay, Pete, thank you so much for taking the time with me today. You not only are you working on InOn Health, but you really are becoming a leader in this space, and so I really appreciate your leadership in Colorado and beyond as you work for health equity.
Thank you so much. Appreciate it.
All right.